Hello, and welcome to today's webcast brought to you by the Center on Knowledge Translation for Disability and Rehabilitation Research, or KTDRR, at American Institutes for Research in coordination with the Campbell Collaboration. The Center on KTDRR is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, known as NIDLR, in the U.S. Department of Health and Human Services Administration for Community Living. The Campbell Collaboration is an international organization that promotes positive change through the production and use of systematic reviews and other evidence synthesis for evidence-based policy and practice. The Center on KTDRR partners with Campbell's Disability Coordinating Group to help increase the number of Campbell reviews in the disability field. I'm Joanne Starks with the Austin Office of American Institutes for Research, or AIR, and I'll be the moderator today. I also want to thank my colleagues, Shoshana Rabinovsky and Ariana Hammersmith, who are helping with the logistics. The KTDRR Center and the Campbell Collaboration are working together to offer a 5-part training course that focuses on high-quality methods for synthesis of evidence, including the procedures and methods for conducting systematic reviews, as well as software, tools, and strategies for analyzing and reporting data. Today, we will learn about several software tools for managing and analyzing data in systematic reviews. We'll hear about Abstrakr. Dr. Ethan Balk is an Associate Professor of Health Services, Policy and Practice at Brown University School of Public Health. An internist by training, he has done extensive applied and methodological research in systematic review and meta-analysis. And he'll start our presentation, excuse me, and talk about Abstrakr.
Thanks, great. So I'm going to be presenting Abstrakr, our citation screening software developed by members of the Brown Center for Evidence Synthesis in Health at the Brown University School of Public Health. Our research was funded, or this tool was funded by the Agency for Healthcare Research and Quality. And you should feel free to contact me by email at any time regarding any questions about this. The link for the software is on this, the title slide here. I also want to mention that none of the people working on this have financial conflicts of interest regarding this software beyond receiving research funds. So what is Abstrakr? It's an open source, open access, web-based, and free platform and tool used to screen publication citations for systematic reviews. It uses machine learning algorithms to predict the likelihood of acceptance of the unscreened abstract. And I'll talk a little bit more about this, but the machine learning allows some semi-automation of the screening process, improving efficiency. There is the ability to annotate citations and also to organize the citations by acceptance status, by tags, and by other factors. Again, this was developed by our group at the Brown Evidence-Based Practice Center and Center for Evidence Synthesis in Health. We are a group, a research group dedicated to conducting systematic reviews, improving the methodology around systematic reviews, and related research. So the major features of Abstrakr: it shows a clean presentation of the citations. It can be used easily on regular computer screens, on tablets, on smartphones. It allows simultaneous multiple screening. So, for example, a duplicate or screening in duplicate, or during pilot rounds when people are being trained about the eligibility criteria and screening criteria. There's an ability to color code and rate the relevance of terms in titles, abstracts, and keywords, words, and phrases. There's the option to tag citations and to add notes about each of the citations. And again, there is the software algorithm that allows prediction of potential relevance of the unscreened citations. This allows a number of different things, including sorting the unscreened abstracts in order of potential relevance. This allows front-loading of the abstracts, the citations that are most likely to get accepted. So relatively early in the process of abstract screening, one is likely to capture the large majority of abstracts that will end up getting accepted. We're still working on the empirical evidence to support this and validate this, but there is the potential to stop screening early or stop the full double screening of abstracts early based on the predictions. And I'll talk a little more about that. So this is a screenshot of what Abstrakr looks like with some annotations. Okay, I guess we lost some of the features here, but what you can see is there's the full title, the journal information, author list, the full abstract, and the list of keywords. If the abstract is long, then the screen, one would just have to scroll up and down the screen. As you can see from the different colors of the text words, there's the ability to annotate using color the title, the abstract, and the keywords. So for example, this is a review about substance use disorder treatments among children and adolescents. So we coded the study designs in purple, the random, the population, cannabis and youth in green, the potential interventions in blue, and some reject terms, some phrases that might indicate a higher likelihood that the abstract would be rejected in red, in this case, adult. Off on the left there's some buttons that allow one to tag the study, meaning to kind of give a short term that gets added to the citation and can be captured later on, and also the ability to add some notes. Down near the bottom of the screen are the accept and reject buttons, and also a third button to allow one to say maybe or to defer a decision. When setting up the project, one has a number of different options, and this is the screen that shows the process for entering a project into Abstrakr. Obviously, give it a name, but more importantly, there are options for either double screening or single screening, and there's options about how the abstracts will be sorted for presentation to the user. Most commonly, people would like to use the option to sort by relevance based on the prediction algorithm, but there's also the possibility of presenting abstracts in random order, ignoring the algorithm relevance. There's also the option to set up what are called pilot rounds. And these can be of any size. So in this setting, the way it's shown now, the team would, all members of the team would see the same 100 abstracts, and regardless how many people there are, and they would all screen those abstracts. And the idea being that once that is completed, the team would get together and can go over the conflicts, maybe see who's an outlier, see what kinds of questions arise from that process. And the idea is to get the team trained to all understand the eligibility criteria in the same way. If a second round of pilot screening is desired, one can just up this number, let's say to 200, and everybody would then do a second 100 screening. After the pilot round phase, the screening would revert to the double or single screening option, where everybody would be presented with the citations, and if it's set for double screening, after two people have given a label for a citation, no additional people would see that citation. The presentation of the double screening is all done in the background. There's no assignments that need to be made explicitly. Okay, so one needs to get the citations up into Abstrakr. There are a number of different ways to upload the files or import the data into Abstrakr. The simplest is to develop a list of citations in EndNote or Reference Manager, and then export out of EndNote as a RIS file, and then that can be directly imported into Abstrakr. And there's some instructions on the specifics on how to do that. Alternatively, if one is using a list of citations that are coming exclusively from PubMed, one can have a list of the PubMed IDs. Abstrakr will go search for the citation in PubMed and populate those fields. There's also a way of creating a tab delimited file, for example, an Excel spreadsheet, and uploading those files if desired. So I mentioned the concept of conflict resolution. If the people who have screened, in this case double screened in Abstrakr, if they disagree with each other, Abstrakr will note that, compile that list of abstracts together, and then either a third person or the team as a whole can go back in and look at that list of conflicts. In this example, there are 35 conflicts, as indicated at the bottom, and you can see that Galen rejected the article and that I accepted this article. The presentation of the abstract is nearly identical to the normal presentation of the citations, really just with the addition of how people screened the abstracts. Once the team comes to resolution, you can then just pick whether to accept or reject the abstract. I mentioned the prediction algorithms. So Abstrakr in the background uses machine learning algorithms to evaluate the abstracts that have not received any labels, have not been accepted or rejected. Based on the corpus of abstracts that have been screened and the labels given to those, accept or reject, actually it's a series of algorithms run to predict whether each of the unscreened abstracts are likely to be relevant. Abstrakr then assigns a value between 0 and 1 to each of those citations. This value is not a percentage or a proportion likelihood that the abstract will be accepted. It's just a way to rank the abstracts. So this is one example from the same project fairly early on, and you could see it's making a prediction as to how many citations are probably relevant. This is a very high prediction, but you can also see how the remaining unscreened abstracts are distributed. The higher the number, the higher the likelihood that an abstract is, or the higher the prediction is that the abstract will be accepted. In our experience, abstracts with a prediction value of less than 0.4 are extremely unlikely to be accepted. So kind of as this distribution shifts to the left, the remaining abstracts are less and less likely to end up getting accepted. So again, when one goes back in to Abstrackr and starts screening again, one will be presented, if this option is chosen, one will be presented with the citations in this order. So those abstracts deemed most likely to be relevant get screened first. Just as a note for people trying to figure out the system, this process of determining these prediction values happens once a night. It doesn't happen on the fly. It's actually a fairly time-consuming, resource-consuming process. So this happens once a night based on everybody's prediction. So usually in the morning, you get the abstract sorted again, and you see kind of a rush of acceptance, and then tapers off, and then the next day, kind of another rush of abstracts getting accepted that then tapers off. There are a number of ways of exporting. Probably the simplest and probably the most common way of exporting out of Abstrackr is into a tab-delimited file that can then be looked at in Excel or other spreadsheet database. We've added in this color coding just for clarification. But what you can see is that there's a study identifier information, any tags people have added, any notes people have added for each of the citations. You could see everybody's label, whether they rejected -1, accepted +1, were not shown an abstract to 0, and where is there? I guess I don't have an example, but if somebody had chosen 0, I mean, a maybe, that would show up as a 0. There's this column here showing where there is consensus and what that consensus is. If there's some disagreement, then that shows up as an X, and these would be the abstracts that get presented during the conflict resolution. This is not the complete database, which is why the conflict here is not apparent. So some benefits of Abstrackr. We believe, and we have some good experience, that Abstrackr greatly increases the efficiency of abstract screening, what is often a very time-consuming and sometimes the most time-consuming step in a large systematic review. The increases in efficiency are largely related to the ability of Abstrackr to predict the potential likely relevance of unscreened abstracts, and thus to front-load the most likely to be relevant abstracts, which then allow one to capture those abstracts that are going to be accepted early in the process. Again, as I mentioned, in our experience, when all remaining prediction values are under 0.4, the screening process becomes extremely rapid because just by looking at titles, it becomes obvious that basically almost every remaining abstract, if not every remaining abstract, is going to be rejected, deemed ineligible. We're still working on validating this, but we hope to be able to more conclusively say in what situations it's safe to stop screening early, which would be a great boon if, for example, in a corpus of 10,000 citations, one didn't need to screen the last 4,000 or 5,000 citations. The tool, the Abstrackr, can be used with the machine learning features turned off if, for some reason, the group prefers that approach. Some other functionality. If one does an update of exactly the same search, you can add the new citations to the existing review. The advantage of that is that this would allow immediate predictions to occur. Normally, it takes several hundred. It takes a screening of several hundred citations before the prediction algorithms start to kick in. But if you already have a full corpus with a completed prediction algorithm, then those algorithms can be applied to the new citations being added in, and one will immediately see the most likely to be relevant citations. And also, one can automatically track the old and the new citations together in one file. There are multiple ways of exporting out of Abstrakr. One of the ways that I didn't mention earlier is that one can now export directly into EndNote. So you can export the whole, the labels back into EndNote, export just those that have been accepted into a file, and add the labels. We're still working on the functionality of this a bit, so we should be able soon to be able to fully export the tags, the notes, and so forth. There's also the option of exporting as an XML file for those groups that deem that to be useful. We will soon be incorporating Abstrakr into another database tool called SRDR+. This is the Systematic Review Database repository that's also developed and managed here at the Brown Evidence-Based Practice Center. The SRDR is a tool primarily for data extraction and also for archiving extracted data. So we're going to incorporate Abstrakr into this database, which will allow for full-text screening within Abstrakr, development of evidence map or scoping maps, and then final data extraction all organized together. Some groups require that a higher level of privacy of the data. So it is possible, it is an open source software, so it is possible to load the software behind one's firewall, which would maintain the databases completely privately behind the firewall, and we're happy to help groups with that. Some other improvements to come, as I mentioned, we'll be transferring Abstrakr into SRDR+. I give the URL for that. And this will streamline the various stages of abstract screening, full-text screening, evidence mapping, and eventually meta-analysis and some exporting tools. As I mentioned, there'll be some further confirmation of the validity of the prediction algorithms and the ability to use those prediction values to stop double or all screening.
Excuse me, Ethan, we do have a question from the audience. Yeah. And that is, what kind of mapping output will be possible from SRDR+?
We're setting up a section in SRDR+, which should be available fairly soon, where one can do full-text screening of abstracts, and then either as a separate process or at the same time answer a number of data questions via simple data extraction. For example, what's the study design? How many people are in the study? What are the interventions looked at? What are the outcomes looked at? And the idea is to just ask simple, basic questions, and then those data would be organized as something that could be evaluated within SRDR and then exported out of SRDR. Currently, SRDR, the export or the output process is, again, as a spreadsheet, as an Excel file, but one can then manipulate the data in Excel.
Thank you.
Okay, so in summary, Abstrackr is simple to use, simple to learn, intuitive, free platform with the primary purpose of screening citations. And it's usable pretty much on any web-enabled device. It allows single or double screening, pilot round training, conflict resolution. There's the ability to mark up abstracts to improve the screening speed and accuracy. There are prediction algorithms available, which again allows front-loading of the most relevant citations to more quickly find those eligible studies. It may allow early stopping of screening once all the machine-predicted accepted citations have been screened. And updated literature searches can be incorporated seamlessly in Abstrackr to allow those to become very efficient processes. There's easy to use and multiple routes of importing and exporting data, importing the citations and exporting the labels with the citations. And as I mentioned, we'll be incorporating very soon Abstrackr into SRDR Plus to streamline the various stages of screening, mapping, and data extraction. So I believe that's my last slide. We've included a number of references regarding the evaluation and validation of Abstrackr. So thank you very much. Some contact information is here.
I want to thank our presenters for taking time to prepare and to introduce these software tools to help manage and analyze data for systematic reviews. We hope you will take a few minutes to give us some feedback about the webcast by filling out a brief evaluation. The link is listed in the slides. You only need to respond once after you have viewed all 4 videos. I also want to thank the AIR staff and representatives from the Campbell Collaboration who helped with planning and logistics. And of course, we want to thank NIDLR for their support to offer these webcasts and other events.